Conversations with Nicole. Let's talk about it. Tell me all about it. I'm here. I wanna know what's on your mind. Ooh, the world needs to hear from you, and I'm so glad to have a conversation to reach the nation. And it's all about you. We'll help each other to discover innovative ways to positively change the world. Let's talk about. Let's talk about. Yeah. Let's talk about conversations with Nicole.
Greetings. Happy Monday. Welcome to Conversations with Nicole. I am Nicole Everett, your host, and Conversations with Nicole is a talk show based in Tallahassee, Florida, focused on connecting the community through conversations. And today is what I call Mindset Monday, which is an opportunity for you, me, and my guests to chat about whatever it is we want to talk about. And today we are talking about minority health equity and disparities, healing the hues. My very special guest is Miss Audrey Bowler-Johnson, a rattler, a sister friend, and a just dynamic woman. She has a very special event coming up here in Tallahassee, and we are glad to host her tonight. But before I bring her on, I need to hear from you. Where are you tuning in from? We are live on Facebook, live on Conversations with Nicole YouTube, and on my personal LinkedIn page. So this is interactive. We fully expect to hear from you. Your comments, your questions are welcome. This is what month is it? It is Minority Health Month, I believe. She's gonna tell us. I think it's Minority Health Month. And so we are kicking it off with this conversation, this important conversation around minority health equity and disparities. So I see you, Miss Kim Blackman in Pensacola, Florida. Thank you for joining us. Audrey is from Pensacola, so I know all of Pensacola ought to be here tonight, okay? Yes. I see Ivy in black and white. Appreciate you. She say, hey, Nicole and Sister Audrey P. Cola in the house. Love it. Appreciate you being here. All right. My sister Shayla is here from South Florida. Thank you for being here, sis. Appreciate you. All right. I know there'll be others joining us, but y'all, please like, share, tag a friend, and tell them they need to be on here because this is going to be a good conversation, a great conversation, a needed conversation. All right. As we move into the second quarter of this year. All right. So Audrey Johnson is a dynamic pharmacist professional with a diverse range of skills and experience at various levels in pharmacy practice, from contributor to branch manager. She earned her Bachelor of Science in Pharmacy at the Florida Agriculture and Mechanical University, go Rattlers, and obtained her master's degree from Troy University and her Lean Six Sigma Six Green Belt training from Villanova University. She has extensive experience in pharmacy practice, administration, consulting, and teaching and training professionals in pharmacy. She's had a colorful career with performances that include pharmacy engineering and design, sterile compounding, specialty home infusion, hospital and retail pharmacy. Her career passions include quality and compliance in practice, rendering inspection readiness, and process improvement development services. And she has performed as an expert witness to conducting numerous case reviews and site inspections for the Florida Department of Health. She has a lot of accolades, and I'm not going to read all of that, but know this. She culminates her career by establishing the RX View LLC and RX View Health, which we will talk about a little more tonight, to provide services in career development, practice consulting, health service programs, and training of professionals in healthcare. And the construct of her platform, Healing the Hues in Minority Health Equity and Disparities, will render collaborative performances to include professionals, businesses, programs, and organizations to unveil solutions to health equity and disparities in this arena. So, y'all help me welcome Miss Audrey Bowler Johnson. Yay!
Hello, hello, everyone. Thank you so much.
You are so
Oh,
welcome. Welcome
yes, yes. Thank you so much for this opportunity to come on, Nicole. I'm really looking forward to having some conversation on a broader platform
to you.
on
Are
this topic.
My
Hmm.
pleasure, my pleasure, my pleasure. All right, we got a few more folks chiming in, so I want to acknowledge them. Fanta Curry, I'm probably pronouncing the name wrong, so please forgive
Okay.
me. Thank you for being here. And cousin Audrey, all right. Kim,
Family's in the house.
the family is in the house. Yes, yes, yes. Ivy's here too. All right, cool. We got Brother Quasi, who is in the Atlanta area. Peace and blessings to you, my brother. All right, so Audrey, my first question is, who is Audrey Bowler Johnson? Not what do you do, but who are you?
Oh, that's always the question, right? Who are we?
Plays the
I
question.
think who we are depends on what season of life we're in.
Mm-hmm.
And right now, Audrey is a passionate health professional person that really is excited about getting engaged and living her life. You spend so many, the first wave of your life being a good child, daughter, and then your sister, auntie, cousin, and then your mother and a wife or whatever. And then you finally get to be a you. So I'm really still learning who Audrey is, but I'm definitely embracing her.
Nice.
Um, so I'm definitely enjoy giving, developing, and training people for their improvements and betterment and successes.
All right.
So that's who Audrey is. I guess so. In the summary, as Audrey is a giver.
All right. Well, you are amongst other givers as well, so you're in good company tonight.
Hmm.
Okay, so I see some other folks have joined us. Pamela Robinson, good evening. Thank you for
Okay.
being here. Miss Tracy Gole, who's here in Tallahassee. Thank you for being here, Tracy. And Miss Jeanette in Miami Gardens, Florida. Thank you for being here, Miss Jeanette. Oh, we got Dr. Eduardo Williams here. So thank you for joining us, Dr. Williams. We appreciate you being on the live tonight. All right, so we are talking minority health equity and disparities. It is Minority Health Month, April is.
Hmm.
And I don't have it right here, but in my post talked about the theme of
Oh, I
my,
got you. Yeah, yeah, yeah. Yeah,
yeah,
the theme.
the
So
theme.
National Minority Health Month
Mm-hmm,
is was actually constructed by NIH, the National Institute of Health,
mm-hmm,
under their subunit Office of Minority Health. And so OMI and OMH puts that together every year and they come up with a theme. And this year's theme for 2024 is Be the Source for Better Health,
yes.
improving health outcomes through our culture, communities, and connections.
Mm-hmm,
And I was so delighted to finally get the theme because they were late releasing it.
yeah.
Um, but the health fair had already been planned since December of
Mm-hmm,
23, not knowing what the theme would be, but definitely
right.
that the month would be active for RX View. And I wanted to make sure some performances took place in Tallahassee.
Yes.
So Healing the Hues and the Minority Health Fair. So when the topic presented and it came out that it was actually Be the Source and improving health outcomes through our culture,
Mm-hmm,
communities, and connections was awesome. So it was
yes,
just divine. It was just divine alignment that
for
the
sure.
topic lined up.
For
Mhm.
sure, for sure. So talk about the health fair. What's tell us, give us all the words. When is it? You know,
Okay, so
Chris.
our health fair is entitled Minority Health Fair Healing the Hues in Tallahassee.
Mm-hmm.
It is April 20th at Jack McLean Community Center. It'll
Okay.
be hosted in the gym. We
Mm-hmm.
have a number of local health providers and service providers that will be engaged and involved. We have the Florida Department of Health. We have CDAC, which is a Center for Behavioral Health. There'll be Sickle Cell Foundation will be there, and I don't want to miss on the list because the list is getting longer. Um, Humana Healthy Horizons will be present. Capital Health Plans will be present. Let's see who else was on the list. Oh, the big one, and well, not just the big one, but everyone's big. The Florida A&M College of Pharmacy will have some students on board, as well as the Council on Aging, the area aging will be present. We have a massage vendor that's coming, Serene Oasis will be on site. We have Stretch Zone, who is a physiotherapy entity. They do stretch therapies. This is kind of like a form of physical therapy, but it's more stretch therapy, more physiological. One of the big things I wanted to mention is we do have One Blood that will be present during a blood drive on site. So I'll have Miss Nicole post up the sponsor number so that you can come and schedule on April 20th at Jack McLean Community Center and donate blood, because we definitely need blood in our community for those situations in which persons can either benefit or survive with those donations.
Absolutely. And is there a cost for this event?
No, it's free community event.
All right.
This is a free community event. So I'm excited that we are able to contribute this to the community of Tallahassee as a free event on April 20th.
All right. So April 20th, 10 a.m. to 2 at Jack McLean Communities Center, 700 East Paul Russell Road here in Tallahassee, Florida.
Yes, health screenings, HIV testings, information will be provided.
All of the
We'll play
things.
a couple of games. We got some music that'll be playing, so it'll be festive.
It will be. It will be. All right. So we got a few more jokes. People that have joined us. My mom down in Miami. Thank you for being here, Ma. We got Sonia B, who's here in Tallahassee. Greetings. Thank you for joining us. Susan, who is in Hampton. Thank you for being here. My sister friend. We got Dr. Joe Johnson here. Thank you for being here. My classmate, actually, high school classmate, Sharice Du Bois, who's in Atlanta, and Ardelia Wilson, Picola, another Pensacola person in the house. Thank you for being here. And Miss Keisha Washington here in Tallahassee. Thank you for joining us. All right. Again, it's Minority Health Month. Minority health equity and disparities, healing the hues is our topic. So let's dive in. Let's dive in. So, Minority Health Month. Why do we even have to have something like that?
Exactly. So I know, right? And then you bring the questions like, how are we the minority? Well, as a classified group, minority health does engage or collectively represent the brown, tan, and brown communities.
Right.
Black folks, brown people, tan, Puerto Rican, Asian, Native Americans, and that is the 5-pillar stance that really falls underneath that umbrella of embracing. And that's where I developed the name and coined the name Healing the Hues, meaning different shades and tones of brown. And we are definitely a leading group in a number of disparities in access. And we'll talk about the difference between equity and disparities, right? So when you talk about health equity, and we're just not equal on the playing field in our comorbidities. We lead the numbers in obesity. We lead the numbers in high cholesterol, hypertension. We are at about usually anywhere between 20 to 30% higher in our community than other cultures, class, and races. And honestly, this is it was very interesting how I led to this path. I've always been in healthcare because my mother was a nurse, so I've always been around healthcare. My aunts are nurses. I'm a pharmacist by profession, and I started in the community in Miami Gardens, and we're actually at that time it was Carroll City.
Yes.
Yeah, so I'm in Carroll City, and I did some training here in Southside, in Tallahassee. So I've been around our people and their health matters for a very long time in my career.
Okay.
But as I navigated through and progressed in practice, I identified the deficit in our our group in understanding,
Mm-hmm.
our participation, our absence of trust, belief. And so that led me down to the path in 2015, 16 to look more into health disparities and equity.
Okay.
And that plighted my passion in it.
All right. So let's talk about health equity and disparities. What's the difference between the two?
So there's some overlay between the terms in description.
Mm-hmm.
But if you think about equity, it's morally being treated fairly,
Okay.
right? Receiving the same treatment, receiving the same consideration, equality, just on an equal playing field. You have
Mm-hmm.
equal access. The cost doesn't, your cost, your coverage, those are controllable variables. When you think about disparities, think more so on like access and environment, social disparities, cultural influences, things that the structure of healthcare can't doesn't control. They're more societal influence.
Mm-hmm.
One big one it would be we have health deserts, where healthcare is not available. We have food deserts
Yeah.
as well. But when
Yeah.
you think about disparities, that's where health literacy comes on board
Mm-hmm.
that we don't understand, so we don't participate. Social cultural influences, like
Yeah.
we lead in hypertension and
Mm-hmm.
obesity, but what's one of those influences? Our diets.
Diet. Yeah.
Our diets, how we eat, what we love, what we've been trained to cook, what we're good at.
Right. Yep.
What we're good at. Um, and so disparities also encompasses disabilities, persons in disabilities, and they're limited in how they can access treatment and how they can even receive treatment.
Mm.
That kind of shadows over into the equity. So disparities are a little different, more social cultural driven,
Okay.
and versus equity is actually policy driven.
Gotcha. All right. Let me pause. I see a few more folks have joined us. Miss Brittany, thank you for being here. Miss Tiffany, thank you for being here. Janita, thank you for being here. Miss Harris, this is my first grade teacher that I partner with at Bond Elementary. Thank you for joining us, Miss Harris. The Right Mix, good evening. Thank you for joining us. All right. So we talked a little bit about those health equity and disparities, but why do you believe it's become such a focal point? I mean, um, why do we care about these disparities amongst minority
Oh,
folks?
we've definitely gotten a lot more attention in recent years,
Mm.
and are shattering the concrete on disparities. And well, if you want to know if something's important, follow the money.
Oh, okay.
So our population numbers have increased.
Mm-hmm.
Um, our number of diverse diversity and race and cultures has gone from you're either black or white or Indian. Now you're biracial. Now we had triracial. Now we've got just a mix.
Now you got ethnicities
We've
included.
got ethnicities and social groups, right?
Right.
And so there's a lot that dynamically that has changed physiologically that
Mm-hmm.
is taxing the health system in the non-Caucasian numbers, in their non-Caucasian numbers.
Mm-hmm.
So in 20 around 2018, I think health equity and disparities was coined at about $65 million. It was costing in like 2015, and then that escalated to in around 2018 that it was $460 million associated, and it hit $1 trillion,
Oh, wow.
hitting the economic impact of in healthcare and disparities.
Mm.
And thus that led to the attention. We need to open programs and systems. How do we get there? And so that's where I really wanted to dive in and saying that's why the tagline of Healing the Hues, unveiling solutions.
Mm-hmm.
We have statistics, but we need to convert those statistics to services.
Okay.
We need statistics to services. But there haven't been a lot of services, but there has been a more welcoming and more embracing. But what has really driven it has been the economic impact.
All right. So, Janita wants to know, would disparities include lack of participating in medical studies?
Yes,
Mm-hmm.
yes. Yes, you're absolutely right. Like with surgeons, I think we're 2% of the surgeons. Medical studies is our STEM programs. We have had an increase now in our participation in those scientific and technology and medical studies, and we have people and persons in positions and studies now that are doing great things. They absolutely are.
So I think what her question is, and Jenny, you can correct me if I'm misspeaking, but I think she's talking about the actual like research being tested to, in terms of studying what the disparities, the quote unquote
Understood.
disparities.
Yes, we
Yeah.
can redirect that. I apologize if I misunderstood your question, Ms.
Okay.
Janita, but yes, you are correct. And there are a number of grants that have been developed, and a lot of research is being put into understanding the
Mm,
social dynamics and social cultural influences
mm-hmm.
that are influencing whether or not how we participate. And let's, if we break it down, within that is social cultural barriers, social influences, but also health literacy.
Mm,
Our health literacy level is beneath where we can comprehend, and where people don't comprehend, they don't go
mm-hmm.
or they don't participate. We've got a 30% less adherence on medication because they don't trust the medicine
Mm-hmm.
or don't understand. And now the names of medications are so complicated that they don't. So, yes, she is correct. There are more studies that have been created and are under development. And you can actually go on grants.gov and see a gamut of
Mm,
entities that have initiated requests for research for better understanding as to where these deficits are coming from.
gotcha. All right. So Miss Harris is your Miss Harris, not my Miss Harris. She corrected me. Thank you so much for that. And Christina Sears from Atlanta has joined us as well. Thank you for being here. So let me dive into that a little deeper, right? So there are some differences biologically amongst the hues, right? Based on just where we were from a location standpoint, based on our skins, our biological makeup, right? And so I think also to Janita's point that, maybe some of these studies haven't taken into account some of the differences that the hues have versus the non melanated folks have. You know what I'm saying?
Absolutely.
Mhm.
And that is absolutely true. And thus that has opened up a lot of opportunity of research. And you'll see a lot of little silo groups now that are rendering services. And so that part of like the health fair, like we did a survey. I had 4 intern students and had one of the interns develop a survey
Mhm.
of general questions because we need to understand how the people feel
Mhm.
in order for us to develop a service or a program around that can be constructed to usher them into willful success,
Yes.
right?
Yes.
Because all of this high level development is taking place, but nobody's actually asking finding out what the questions are, what the issues are of how to get there. So
Mm.
there has been a shift in mobile healthcare. Um, I'm real concerned, and I know that there are concerns now around digital health. The
Mhm.
healthcare terrain is changing rapidly. And so there's a lot of concern that these disparity gaps that are already present are going to expand because the literacy level, health literacy, is tagged to be around eighth grade level, sixth to eighth grade level. That's where forms are constructed in language and word choice to be at a sixth to eighth grade level of comprehension.
Okay.
And including pictorials, pictures.
Mm-hmm.
We have language barriers.
Mm-hmm.
We have, and so that competency that the professionals are missing has created this deficit because there's an absence of competency of interacting and knowing how to converse or have the tools or resources in your practice to speak with them. I'll give you an example. Here in Tallahassee, and I'm working in a community pharmacy. A gentleman came in. He's Hispanic. It's Friday evening. It's 7:30. He's frantic. He's probably in his mid 60s, early 70s. Didn't know where his medicine was, but he spoke minimal English. He spoke no English. He spoke English. So he's trying to find his phone to download the app to communicate. I have some Spanish speaking that I can comprehend and interact with my customers only because I worked in Miami for so long. But I'm only, I only dialogue to that level. But I was able to engage with him to ask him, where are you looking for? What did you need? What is it that you need? And he said he needed his medicina. Where's the doctora? He gave me the number, and we get the number. So nonetheless, I have to call. He didn't know CVS, Walgreens. He had those two terms. We ended up finding it.
Okay.
The doctor, but nonetheless, so to point is the percentage of Hispanic persons in Tallahassee has grown. And I was not able to find one office for him to go to.
Yeah.
So competency. So some of it is gender competency, how we interact with men. Men's health is at a deficit because our men don't feel listened to or heard or trust or comfortable with a woman looking or touching on them. So yeah, let's answer some questions.
Okay. So let me just acknowledge a few folks. Deborah is here. Thank you for joining us. And Ivy, I'm going to get back to your comment in just a moment. We got Samantha from watching from VA, friend of Fanata. Thank you for being here. And so Miss Jeanette wants to know, what about research? The research, all of us, the organization asking for 1 million persons to join for health research. Are you familiar with that?
I am. And there is a big push for us though. So when we talk about research studies, and forgive me, Jeanette, if I misspeak on the direction of the research in which you're looking at, but on medical research, right? For new medication that's coming out, our percentage of participation was less than 1% representative. So new drugs go through trial phases before they're released into public for use.
Right.
But they weren't tested. We didn't have enough participants of African Americans in the study to know how is it really going to react in the body. But it had to be released because we just don't participate. So there's a big push for research studies in that our persons, we're comfortable with participating in research with these, these matters. So kudos to Jeanette and how you're going to get, because I think this is going to tie into Ivy's question, is that we're reluctant to trust. And so go ahead. So that Tuskegee thing did it.
Yeah, so it's a comment. She said people of color are reluctant to participate in health studies due to history in America. And Ivy, I'm maybe speaking for you, but there have been studies that have been done where the American powers that be did these studies on Black folks and weren't forthcoming with what it was. So correct. And so this is part of the reluctancy, the distrust, the hesitancy, I think, by the Hues, the people of color, to participate.
And the Henrietta Lacks,
Henrietta Lacks, So all of these things. So what's your What's your thought? What's your input on that?
So my input on that, I think Jeanette is definitely the more leaders we have, and that was a deficit space too, is that we weren't represented professionally in these spaces to gain the trust of our people.
Mm.
If we're more represented and we're more engaged, we're more available and participating, they would rather trust me than my white counterpart if we both walked in the room together.
Mm-hmm.
Okay, that
But
would work for me.
are we, even those who are, you know, black, who are persons of color who are in these positions that of trust, as doctors or administrators, can they be trusted? I mean, are they?
There are some challenges. There are some
I
challenges, right?
I
And
know you
so,
can't speak for every person of color in the field, but it's concerning.
oh, it is concerning, and it is actually validated and factual, because I've been on the receiving end, and I've been on the experience side of mis. I want to say undertreatment or mistreatment, and I had to speak
Mm-hmm.
up for myself. So we do have opportunities that we need to increase our presence and be at that service. We were talking about adding those services to be health navigators, to be medical liaisons, to support
Yes,
and assist our
agreed.
general community and population when they go to the doctor's office or have
Agreed. All right, we
post-surgical
having a
procedures. There's not an equal treatment or listening, and there is some. They think that we're drug seekers. So I'll see a patient come in with that's non-African American with a count of 120 tablets of Lortab every 30 days.
mm,
And I had a young man that had an injury. They gave him 12 tablets on a Friday night.
mm,
And we see it all the time. And there has been conversation about, the mistrust and the misunderstanding teachings in medical school about our threshold of pain, and Black African Americans have higher thresholds of pain, and
mm,
we're misbelieved and things of that nature. So
mm.
yes, I do think professionally, if we're more available and more engaged and present in those positions, we can be more influential in gaining traction of participation. And so I hope Miss Jeanette
Okay.
can share with us and see where we sign up.
Yes, thank you. All right, so we are a little more than halfway through our talk. For those of you who are just joining us, I am on with Audrey Johnson, pharmacy professional. We are talking about minority health equity and disparities, healing the hues. The right mix, who is Peachy. Thank you for letting me know that's you, Peachy. She said, do you think the lack of participation is fear from being misdiagnosed? That happens quite frequently as well. So sometimes there's a misdiagnosis for whatever reason. So do you think maybe, it's like the if I don't know, or ignorance is blessed.
Well, I mean, I understand what she's saying, like misdiagnosed. A lot of people have been misdiagnosed because they don't understand how we talk, not
Mm,
how we speak, but how we talk, and our engagement. And this is why it's so valuable to have African American physicians and health practitioners in our diagnosis. I'll
mm-hmm,
give you a story, young lady. Talk about misdiagnosis. She was having an anxiety situation, um, presented to the hospital. They were going to put her under observation.
mm-hmm,
Now she's there. I think she was like mid 20s, 30s, or something thereof. And she went under evaluation. White nurse comes in trying to talk to her. She leaves the room. She gives a diagnosis and a recommendation that she be sent up to the ward for a minimum of 3 days.
mm.
Black nurse says, well, why, how did you get that assessment? She says she's sitting there hitting herself in the head for no reason. Yeah,
Oh,
we.
oh my
She was
God.
about to be escorted to the psych ward
Because she
under
was
observation and
right.
medication,
Cultural competency.
cultural competency.
Mm.
Cultural competency.
So
Had the
Peachy,
black nurse not been there.
she said,
And
yeah, she
yeah,
has She said I had a family member that was misdiagnosed because of their pain threshold and she passed. I'm sorry to hear that, Peachy.
Yeah,
Yeah,
sorry to
so
hear.
I think to your point, again, that cultural incompetency is another contributing factor. Ivy said it as well. That's why we need more Black medical professions to conduct the research being conducted.
Mhm.
Um, Joel, he said, "Hello. I often speak with college-educated melanated people who have willful skepticism for any health intervention that requires a change adjustment of their lifestyle." Interesting. I would be curious as to why they have this skepticism. So if you have some either insight on that, Dr. Joe, or
I want to think that he can say and he can answer this or not, but just like our people that know they have diabetes, but they still want to eat the cake.
mm,
They still want to eat the sweets. And they
mm-hmm,
don't want to do diet modification. And they don't
right,
want to actually consistently exercise. Okay. And diet exercise is not the answer. So, I mean, not the only answer. However, adjustments in their lifestyle, we're not easy to willfully change because of then goes back to the trust. I
mm-hmm,
don't believe that medicine works anyway.
mm,
Then
mm-hmm,
there's a cost element. So side effects, especially with men, if it's going to interrupt their their sexual performance,
mm-hmm.
they're gonna shy away from using it.
Gotcha. All right.
Hmm.
I'm gonna come. I got something a follow up to that. Marcus Boston has joined us in Tampa. Thank you for being here. So, as it relates to that adjustment in lifestyle, um,
Yeah, ask him. Was that correct? Was that the correct angle? Hmm.
yeah, I'm curious about that. So, if you can, Joel, if you're still on with us, give us a little bit more insight on that, if you don't mind. So, I'm curious in terms of your thoughts about what some of the solutions
Hmm.
are. What type of solutions are needed? And before you answer, one of the things that kind of comes to mind to me is some of the more holistic natural remedies. Like I think of, say, a George Washington Carver or Madeira or Big Mama who, knew which herbs or plants could be used to cure whatever was ailing us, right?
Hmm.
So to, talk to us a little bit about like what your thoughts are about some solutions to these disparities.
So when you say the solutions to disparities in the manner in which you're speaking about utilizing herbs versus tradition, medication, commercial medication things, I do strongly support utilization of herbs. I
Mhm,
do support that, mainly more so
mm,
detoxification. I will say that the underlying matter that I identify that I think is the unspoken is the is how our foods are being processed,
mhm,
how food is being processed, the plasticizers, the preservatives, all of these behavioral changes that
mm,
we have seen, the common denominator between all races, ages, and culture is food.
mhm,
It is absolutely food. So if we're seeing an uptick in obesity across the spectrum, the common denominator between across the spectrum is one common element, which is food,
right.
right? So yes, I do believe
Okay.
that the herbs are
All right.
beneficial. Another solution would be medical training. I really
Mhm,
believe that cultural competency and social cultural competency should be a required course. It should be
mhm,
required in any accredited medical health professional track,
mhm,
which it has not been. We're navigating a very, very aggressive terrain of change in healthcare. Digital health is
mhm,
is going to lose our people. We are.
mm,
We still have people that don't know how to do a telehealth appointment.
Yeah.
And to dial in and place your face and turn your camera on, all of those steps that go along with that. And now it's progressed not even to just telehealth where you physically look at the person on the screen like we're doing, but to telegraphic, and they're only texting you, and
Mm,
and then
mhm.
you take a picture and you text them the picture of your ailment or area of something thereof, and
Gotcha.
they'll just do a prescription. You never see them on the screen.
Mhm.
We're going to navigate really aggressively down. We got a lot of wearables now. Um, they're testing AI to
Mm.
actually even look for you to look into your screen on your phone, and it can measure your eye pressure to determine what your blood pressure is.
Oh, wow.
We're our culture, our people are going to be lost in digital health.
Mm.
My bigger concern is we are participating. We have a lot of young professionals that are navigating their careers, and they're visible and present in those spaces, but we are leaving the people.
Mm.
We're leaving the people behind, and those services need to be bridge gapped into integrated. So there's a deficit space of opportunity, which is like I say, healing the hues, unveiling solutions, where we can provide that healthcare concierge service and supportive care service and help navigate them through. Go
So
ahead.
let me pause real quick because I really want to hear from the viewers to see if they are if what their take is on this digital health, telehealth,
Mm.
if they have participated in telehealth, digital health, and was their experience favorable, or do they have a preference? And I know I'm asking a whole lot of questions, but just if you don't mind sharing, again, safe space for us to communicate. Share if you are for digital health or not for it. And if you're for it, again, no judgment. Do you think it is comparable to having an in-person appointment? Let us know. We have a few comments. Joel came back and said, so his comment was around, let me go back to the original, was college educated melanated people who have willful skepticism for any health intervention that requires a change or adjustment of their lifestyle.
Okay.
He said because money for cruises, top shelf liquor, etc., but not medicines, doctors, and visits. So I guess they're like, YOLO. You only live once. I'm trying to live my best life. I ain't trying to do all of that.
Now he hit on something very big with that, because that Gen Z, Gen X generation, they're not participating in healthcare as the let's see, the generations prior, right? Grandma and them believed in the doctor. You need to go to the doctor. Something's wrong. I got to go see the doctor. They believed in the doctor. That next generation
Mhm.
of parents are too busy to get to the doctor. They can't even take off to get appointments. So that Gen Z, Gen X, they haven't been brought up in that health preventive rim. They just thug it out, basically. They're just like, oh no, I ain't going. They're not really understanding what the insurance is. Their their literacy of the health navigation terrain, and the interactive voice response system, that IVR, they have zero patience for that. Press 1 for Dr. This, press 2 for this, press 4 for that, press 5, and press 7. If you're this, then press 8. They're not doing it. They're not participating.
Wow. All right. Donna Wallace
They're
has
liquoring
joined
the
us,
cruises.
who is a pharmacist down in Miami and one of my classmates.
Hi, Donna.
Thank you for being here, Donna.
Yes.
She said she came late, but she definitely agrees that nutrition, food, and change in mindset are important. Yes, they are. Deborah, she said, I don't let providers know I'm a nurse practitioner and don't receive the correct care. Once I see it, I step up and let them know, and the care changes. Now, that is scary right there.
It's true. That happens.
That's super
Yeah,
scary.
that happens. If you don't speak up, you won't know. I mean, my leg was broke. I got brought in the ambulance.
Yeah.
They didn't see the fracture. They didn't see the it on the X-ray. But I mandated an MRI, and she said, "Well, you'll have to go to the MRI." I said, "Lady, I came in the ambulance." But I had to let them know, okay, I'm of this and this and another. We got it done, and that was
Why you gotta
chiropractic.
do all of that though?
A lot.
That's the part that bothers me. Like, so for people who aren't and don't necessarily know to advocate for themselves or thinking that there's some other options outside of whatever this person is telling them, which is not the best
This is
care.
where we need to empower our people. We had to have more of these conversations, more of these forums and dialogues to empower people with the right questions. I like what
I'm
Janetta
gonna get
says.
to it. I'm
You
gonna
go to
get it.
her.
All
Yeah.
right. So Ivy said this is why minority health fairs are important, but also support from the community to attend them. So y'all
Yes, thank
definitely
you.
need to be going to these health fairs.
Right, and we need
Right.
to have them a little more frequent. We do. We
We do.
probably could benefit from rotating around and until we can build up some confidence and some strength in healthcare. Go ahead.
Absolutely. Janita, I find that my parents do not ask the correct questions when they see the doctors. Most of the time, I have to send them a note with questions they have to ask. They wouldn't do well with digital health. However, I don't mind seeing telehealth docs, but not for every situation.
Mm.
Okay. Thank you for sharing that, Janita.
Yeah.
Appreciate you sharing that. All right, Dr. Williams, he said, as far as research is concerned, most of our providers that belong to the Hue practice in corporate environments and don't have the liberty to participate in studies without corporate consent. Interesting point. Thank you for sharing that. All right. Oh, I think this is, oh, the name is escaping me, but I think I know who it is. Thank you for being here. All right. Sonia, I participated in virtual appointments where I would need to visit only for blood draws or urine specimens, but all else was handled online. I appreciated the convenience of the virtual appointment. All
Mhm.
right. Okay, thank you for sharing that, Sonya. I think that kind of aligns with what Janita was saying about, some appointments, but not all being virtual.
Oh yeah, it is beneficial, and it definitely has expanded
Mm,
access for
yeah,
those that can't travel. But then there's also that deficit on the education. So what did Donna
indeed.
say?
Once they know you are educated, they change quick. Yes.
Right.
That's awful. Shortages in providers and the rush job on appointments can lead to mismanagement of our health. Absolutely. Absolutely.
Yep, and that does happen. So I like how the young lady mentioned about, have your notes ready or have a dialogue ready, and that's one of the projects that I have my next round of interns working on is this health diary,
Mhm,
right? And
mhm.
so we'll be providing health diaries so
Okay.
that you go in equipped with your Bible and say,
Yes,
"No, I got some questions. I have to get these. I got to get these back to Miss Audrey." You know what I mean? So
yes,
um,
yes.
to help support that need of knowledge and information.
I
So
like that. Health diary. I'm putting that down as a solution. All right. Dr. Amala Haynes, who is here in Tallahassee, thank you for joining us. She said telehealth, I think, is good as an access point into care. However, the screen cannot allow for an actual physical exam. Touch will be lost, which might lead to more distrust of providers. Also, and I'm having some technical issues, y'all. Forgive my connection. Um, let's see, touch will be lost, which might lead to more distrust of providers. Also, the automation makes the visit impersonal. Health literacy is one way to empower people to have deeper understanding of their own health. Absolutely. Thank you for sharing that
mhm.
and again joining us. Miss Jeanette, all of us has an app sponsored by Vibrant Health Inc. Individuals can download the app and get information. All right. Thank you for sharing
Okay,
that.
thank you for sharing that.
Donna, I got involved with my parents' care and now they are on top of it.
Go
Wonderful.
Donna.
Glad to hear it. All right. Peachy said, I had a telehealth appointment and it was useless. Physicians aren't the same as 20 or 30 years ago. While tech is cool and may be more convenient, doctors used to be really involved and did the research. Thank you for sharing that, Peachy. I appreciate you sharing your experience. Deborah, physical exams are needed initially for certain issues, but it's okay for some. All right. So, talking about telehealth and appointments, Dr. Williams, we need to teach patients how to go to the doctors with questions in hand. This will require more advocates. Absolutely.
Yeah, because it will hold them accountable.
Mm-hmm.
If you at least have some guiding questions and some construct for your office visit.
Mm-hmm.
And it's easy to forget what you were going to ask, and especially our older population as the elder, and they get a little bit uncomfortable. And plus, if you're already uncomfortable,
Mm-hmm.
your whole thought table is off. You're like, dang, I was supposed to ask him about such and such. That way, you kind of go in equipped. So
Absolutely.
a part of those solutions, like we were talking about, I guess you're making notations so we can round about on
I am.
solutions.
I
Okay,
am. Mm-hmm.
um, yeah, I like that. So telehealth is great and it will be beneficial. However, there is going to be, I think, an increase of misdiagnosis than not.
Mm-hmm.
Um, I had a young man that came in the other day, and he's an African man. Actually, the girlfriend presented and was hoping that we had, what do y'all have for muscle relaxer over the counter?
Mm-hmm.
And I had to ask those questions. Well, what kind of muscle pain is it? Where is it? And does he have any underlying conditions? And then she said, it's kind of all over. He has sickle cell.
Mm.
So he's in crisis.
Yeah.
So we've got these young adults that are adulting and they're in college and not knowing how to manage their condition.
Mm.
And so he was actually in a health crisis, had to get on the phone, who's your doctor, put out a call, get the meds, and get some prescribed meds so we can get him
Right.
ushered through the sickle cell crisis, which is
Mm.
extremely painful. Extremely painful.
Yeah.
Yeah.
All
But
right.
had I not been astute on sickle cell, because
Mm.
I'm melanated, because I'm a black woman that understands our condition, someone else would have just said, oh, it's on aisle 12.
Mm-hmm. Yeah. I got
Right?
you.
So
I got
that's where that training, it should be required so that you are competent with all cultures in relevant situations of prevalence.
Absolutely. All right. Ardelia said, as a former office nurse, I would encourage my patients to know their medication and to write down questions for the doctor. Ordered lab work prior to appointments is essential. Come prepared for your appointment. Yes, that is true. Ivy, telehealth has its benefits. As a freshman in a dorm with no transportation, my daughter was able to have a telehealth visit for pink eye. The prescription was called in for when she got to the pharmacy. All
Hmm.
right. So there
Hmm.
again, there are
Yeah.
it's pros and cons. It's pros and cons.
Absolutely, there are pros and cons. We
Mhm.
just want to make sure that we have a support in place for those that aren't as comfortable with it or
Yes,
know how to navigate through those terrains.
indeed.
Hmm.
All right, Sonya B, supporting us with being better advocates for ourselves will also require a shift in mindset. Absolutely.
Okay.
So that we take back responsibility for our health rather than sitting back and placing that on the doctor.
And
Uh,
I like how she mentioned that, Dr. Sonia. I think that's really nice saying
mhm.
I get excited to see all these exercise groups, man. I'm so motivated by the movement. I do believe that there has been a movement, in the last 7 to 10 years that has shifted, that we got a
Mhm.
more participation. Even your dance group, you and what's your lady's name?
Yeah. Joe Keetra.
Yeah,
Joe
y'all do
Keetra.
your line dance. That's a form of exercise. And so
It is.
exercise is definitely increased in our community. So we
It
do
is.
have a larger person, that group of people that are taking it back a little bit. So that's good stuff.
Absolutely. Absolutely. And with our seniors, I know they have sneakers where the seniors can get exercise at various locations in the community. So I know my mom talks about it all the time because she goes every now and again. All right. Peachy said it also depends on the physician who is doing the telehealth appointment. That makes a difference as well. Absolutely. Ivy, yes, because she is young and tech savvy, talking about her daughter. She was not intimidated by the process, whereas older generations are not so savvy.
Mm.
Agree. But they're learning. They have some of them have technology classes at the senior centers that they attend or they go to. So they're learning. Uh, so if they're willing to learn, teach the older generations because this is the way that is. We are definitely moving in that direction more and more and more. All right. Let me see. Did we have any other points we wanted to mention? National organization and government entities. Anybody?
Yeah.
Any in particular that you want to mention?
Yeah, I like to mention that, the National Institute of Minority and Diversity,
Mm-hmm.
NIMD.
Mm-hmm.
NIH has the OMI, which is the Office of Minority Health, and um,
Mm-hmm.
and there are a lot of upcoming groups too. Like I know we have a lot of silos. I just actually found a group last week called Now Included, and
Mm-hmm.
so they're making an aim to develop a network. Um, just as that would be the ultimate goal for RxView Health, to become a hub, and we actually bring our entities together so that we can access and be supportive of one another collaboratively. Collaborative practice is going to be the next wave of where healthcare concierge services, and
Mm-hmm.
our people need it, and you're going to benefit from it. But yeah, there's some national organizations. Definitely, reach in and look at it a little bit deeper into whenever you see posts about minority health or disparities. Educate your own family, motivate and encourage them to get more engaged in their health care,
Mm-hmm.
and reach out for help if you need support and you're not understanding. Use your resources in
Yeah.
your circle. I mean, I think some of the churches have health missions, or there's some local entities you can always reach out to, and all the services you don't have to pay for. There are a lot
Right.
of free services that have been granted funds to render the supportive services. So reach out to your counselor on aging, and you will get some information there.
Yes, and if you don't have insurance, there are health clinics around, especially in Florida. I can't speak for any other state, but the Department of Health has certain aspects of health that they cover. Some things they don't, but a number of things they do. But
And they'll be at the health fair.
yes, and there are also federally qualified health facilities here in
Hmm.
Tallahassee, like your neighborhood
Hmm.
health clinic and your bond neighborhood health clinic. Like those are, they receive federal and local funds, and I think state funds as well to provide health care to those who either um, don't have insurance or have limited insurance. So, you definitely want to check out those entities
Yes,
for.
so there are 14 counties in the state of Florida
Mm.
that were awarded those monies under the Closing the Gap.
Oh, okay.
There's 14
Right.
counties that are under the Big Bend alone.
Gotcha.
It's 14 counties that spread over, and Pensacola does too have
Okay.
funds under the Closing the Gap to do the services exactly what you're making reference to, so
Hmm.
that it provides care without cost. So
Yes.
there's care without cost.
Okay. Let's see. Marcus, healthcare appears to be better in Florida than in Illinois. All right. Well, you enjoy it while you're here, Marcus. He's from Illinois. Miss Jeanette said, I think some seniors are becoming conditioned to expect to be on meds. They can name medications like naming the top tunes of the day. Senior must understand their meds. Yes, they should. And also, I think also be working towards trying to eliminate them if they can. If there's something that they can change in their lifestyle such that they don't need the medications, they should be striving towards that.
Yeah.
Let's
Mhm.
see, Kim, there are a number of free or operate on a sliding fee scale. Okay, thank you for sharing that. Let's see, Pamela, walking is beneficial and free. Yes, it is. Thank you for sharing that. Oh, goodness. All right. And then Dr. Williams, there are many community health centers in all states, National Associations of Community Health Centers. Thank you for sharing that as well. All right. Well, I think we are well, very close to our hour. So I'm going to give you an opportunity to give some closing remarks and tell folks how they can connect with you. And then again, mention the health fair coming up, if you don't mind.
Well, I definitely appreciate and thank you for participating and attending and allowing this stimulating conversation. Healing
Mhm.
the Hues is very necessary to close those gaps and contract those gaps of disparity and equity of care where we can. So, being a health advocate, be willing to learn, because it's going to help and benefit you, and it'll help and benefit your family members as well. So, have those open conversations, write down those questions, and support wherever you can. The health fair will be at Jack McLean Community Center April 20th, Pensacola. We'll be Healing the Hues in Pensacola as well in June.
Mm.
But we are Healing the Hues here in Tallahassee April 20th at Jack McLean Community Center. You can contact me directly for any projects or speaking engagements. A little bit more information at info at the RXView, THERXView.com. My 888 number is available. I look forward to having any conversations and being supportive where I can and healing the hues to unveil solutions. So thank you.
Yes. Yes, yes, yes. Again, I don't know what is going on with this technology, but hey, we're gonna still try to roll with it. Hopefully, you all caught all of that. You see Audrey's information at the bottom of the screen, and somebody keeps texting me, so I'm gonna put
But
this.
I'm definitely will be posting and sending out for more information, like asking polling questions, because we need to know what your internal barriers are instead of just forcing you this framework of what support looks like. We need to
Yes.
know what the support needs actually are. Do
Mm.
you rather your communication be via phone? You want to see more newsletters? Um, where is the deficit for you, and then collectively we can kind of put those together and we can kind of construct a health plan or supportive service that may be beneficial.
Indeed, indeed, indeed. All right. Well, again,
Thanks
thank
everyone.
yes, thank you, thank you, thank you. For those of you who are new to the platform, I invite you to subscribe to the Conversations with Nicole YouTube channel. We are here on Mondays and Wednesdays at 8:30 p.m. Eastern, focused on mental health and wellness in Black and Brown communities. And so our physical wellness is part of that as well. Our mindset shift about healthcare is that as well. So these solutions have been great. I hope this has benefited you. If it has, let us know in the comments. A few of you already are. And let's keep this conversation going. Let's keep this conversation going. So please share this link with someone, tag someone, let them know that they should check out this conversation. For those of you who are watching the replay, comment, let us know, because I do go back and check out the comments afterwards. And so it has been really an engaging conversation. I think one of the things that I really got out of this was the whole health journal piece. But
Mhm.
solutions that we talked about were, changing diet, changing mindset, medical training for
Mhm.
those in the medical field, having that cultural competency, in person and telehealth, maybe a combination of the two, health journals, having your questions ready, knowing your medications, and then having those open conversations so that you can advocate for yourself. So lots of folks are chiming in. I love it.
Great.
All right, Kim, very informative. Wish you much success with the health fair. Deborah, love this. Peachy, great discussion. Thank you. I wish you continued
Thank
success.
you.
Ardelia, thank you for sharing the information. Janita, thank you both. Great conversation. Derek Bell in the house. Thank you for being here.
Okay, Mr.
Great,
Bill.
great information. Cherise, great topic again, very beneficial. All right. I'm going to advise folks to listen to CWN to increase their health IQ.
All
Yes,
right.
love it. Yes, yes, yes. My mom said valuable information. Dr. Williams, great forum. Again, Dr. Williams, thank you for being here.
Yes,
Come
thank
back,
you.
Dr. Williams. Come back. I
Yeah,
think
we
you come back.
appreciate that, Dr. Williams. Thank
Yeah,
you.
for sure. All right, Ms. Curry, thank you for the great information. Sharice, definitely be an advocate for yourself concerning your health. Yes, yes, yes. We got to do it. All right, good people. Well, you all have a great rest of the evening. Oh, I see a few of you still. Thank you from Joel. Tommy B, I enjoyed the information. Thank you, Tommy B.
Good.
That's another one of my classmates. Appreciate you. Yes, thanks, Dr. Williams. Great info. All right, cool. And Tracy Golay. Go ahead. What you got?
I want to ask if you will, I mean, I want Dr. Williams to come back, and I would like, Tommy, we really in June, if we could talk about men's health. That
Okay.
psychological imprint is
Yeah.
a conversation that we need to have.
All
So
right.
I would welcome an opportunity to forum with it.
Okay, Dr. Williams, she put it out there. My calendar is open in June, so if you are willing to be a guest, I would love to
That's Men's
have
Health
you.
Month. Yes.
It is Men's Health Month, so let me know. Let me know. Let me know. All right, Amala, Dr. Haynes, excuse me. Yes, thank you for being here. Marcus, thank you, Marcus. Oh, he said no problem. All right, y'all saw it right here.
Hey, okay, y'all got it. I got it.
We got Dr. Williams gonna be here in June. I'll follow up. Oh, she said she meant Dr. Johnson. Yes. All
Okay.
right. My mom, I think she was trying to say please. Yes, mom. We got you. We got you. All right. Again, great discussion. Thank you all for your engagement. We will be back here on Wednesday talking about mental health versus mental illness with Jarvis Wright. Yes, mental health
Mm,
versus mental illness. They are not the same.
they're not the same.
They are not the same. All right. Y'all
Oh, it's not
have
the
a
same.
great
Okay.
night, and we'll see y'all next time.
Good
Peace.
night.